In this presentation, we're going to talk about recovering the copings from the invested ring, finishing the metal, conditioning the metal to receive porcelain, and application of the porcelain for finishing porcelain fused to metal restoration. So after the casting it's done, we have to allow for the ring to bench cool, and then the ring will be ready to be divested. Um, the easy way to divest the ring for porcelain fused to metal or metal coping or framework is to use a hammer and hit the ring in the bottom where the hole is, not hit it on the side because sometimes the margins of the restorations might be a little bit thinner, and if we hit it too hard with the hammer, we may distort the margins. So always hit it from the bottom. Once we take out most of the investment, then we can use sandblasting unit to clean up the investment from the copings or the framework. Cleaning and pickling or deoxidizing the castings. It's very important to know that some of the ceramic dental alloy, as part of conditioning for application of the porcelain, needs to be pickled. So we're going to talk about the pickling process. Cleaning. We can use a stiff brush under the running water to remove any little investment that might be stuck on the framework. Also, sandblaster with the glass beads under low pressure might be used to remove any investment from the outer casting surface, while aluminum oxide might be used to remove the investment from inside the crowns. Always use caution to not use too much pressure when we use the sandblaster, because that can put a lot of stress on the dental alloy, but also if we keep it, the tip of the sandblaster, we keep it in one area of the coping, we can poke a hole through it. So always make sure that you use the recommended pressure for the sandblaster, and always move the tip of the sandblaster around until everything gets clean up. So in terms of the pickling, like I said, some of the ceramic dental alloys may require a pickling or deoxidation process, which means pickling, it's acid. So it means that the framework, after it's invested, it has after it's casted, it has a layer of oxides on the outside. So what the pickling process does is remove that oxide layer and prepares the surface to receive the porcelain. So pickling being an acid, we have to be careful not to use our hands to put the framework into the pickling acid. Have to be careful with that. Also, we have to lower it slowly into the acid, not to drop it so it doesn't splash. Always wear goggles. Always use gloves, thick gloves, to protect your hands during this process. So use and always use manufacturer instructions in terms of the pickling solution. So how much the acid should be, if the pickling solution might be diluted with water. Also the time, how long the framework has to be kept in the pickling solution. Most recently, the new dental alloys are very good, and some majority of them they don't require pickling anymore. But it's good to know that some of the materials that we're using require an extra step. So that's the pickling step. Also, in terms of the time, sometimes pickling requires to be done overnight or maybe for a few hours. So again, always read and understand the manufacturing instructions in terms of the pickling. Finishing and polishing the casting. So finishing of a casting consists of inspecting the casting for defects, removing the sprue, test fitting the casting on the die, rough finishing the casting surface, checking the contact areas, adjusting the occlusal surface, and polishing. So very important also is to inspect the casting for the defects. And it's recommended to use a magnification to check the casting surfaces. So the surface of the casting should be smooth, dense, incomplete, meaning that there are no voids, especially on the margin. There are two major kinds of defects to look for, positive and negative. So bubbles of metal or fins that protrude from the casting surface are called positive defect. So something that is sticking out from the casting. Porosity, holes, and incomplete casting are classified as negative defects. So where we have holes inside, voids, those are the negative defects. Holes can be also solder. Porosity and incomplete casting usually means starting over. In terms of the holes and the soldering process, it's true that they can be soldered, but again, also counts the size of the holes. So if the holes are too big to be soldered, it's not recommended. It's recommended to start all over again. Why? Because even though the solder it's compatible, the solder metal is compatible with the metal of the casting, the bond between the two of them is not always 100%. And when we start applying, and also the solder sometimes it doesn't have the same ceramic ability bonding with porcelain, like the metal that we use for the coping. So that's very important. So if there is a small hole, maybe we can solder, but if there is a big hole, it's recommended to redo the coping. Before a casting can be test fitted on its die, free the internal surface of the casting of all positive defects. So in other words, turn the coping and look inside, and if there are any little bubbles, always grind them off little by little. Don't grind off too much because that may make the coping loose on the die. It is highly recommended that a microscope is used in this process. Remove noodles and fins with a round carbide burr or adequate size in relationship to the defect. So always make sure you don't use a big burr because that takes out too much of the surface of the inside surface of the coping. And like I said, that may make the coping loose on the die. Never grind or polish casting on the internal surface. So the internal surface inside the coping is never to be polished. Why? Because we want the internal surface, the inside of the casting, to have a rough surface. So the cement, when the crown is inserted in the mount, the cement is going to have a better grip on the surface, all over the surface of the coping. Okay. The next step would be to remove the sprue. So for that, we can use a separating disc to cut the sprue. Always be careful when cutting the sprue, not to cut too close to the coping. Maybe it's better to cut a little bit more towards the sprue, leave a little more of the sprue than cut it too close to the coping itself. And then we can use a burr to clean up that excess material, metal that we have from the sprue. So this is an image of blasting and despruing. So blasting with aluminum oxide according to the manufacturer's specification in terms of what type of abrasive material we should use and the pressure, and what type of discs we can use for cutting the patterns or the copings from the sprues. Again, the same procedure. So we're going to use a cutting disc to cut the pattern, to cut the coping from the sprue, and then we can fit the coping over the die. So we have to make sure that the inside, the coping in picture B, it's nice and smooth and there are no bubbles in there. And like we can see in picture C, how the margin and the fit of the coping, it's perfect. The margin of the coping meets the margin of the preparation. The next step would be to use a stone to grind the excess metal where the sprue was and reshape a little bit of the anatomy if it's necessary. Also, this is the time where we might need to smooth the margins, maybe thin them up a little bit, if only if it's necessary. In terms of what this picture shows here with the polishing and adjusting for mesial and distal contact, this is only available for and should be done, this procedure should be done only if it's a full metal contour crown, which is not the case for us. We're just doing a coping, and on top of the coping, we're going to put porcelain. So the only thing that we have to be careful is how we finish the surface of the coping to receive the porcelain. So it's either we need to pickle it or we need to sandblast it and clean it up, sterilize it. And also we have to check for the fit on the die and also the check on the occlusal clearance, how much space we have to apply porcelain. So how we test fit the casting on the die. Examine the internal surface of the casting for positive defects, so bubbles, under the microscope and eliminate any defects. After all the internal surface's positive defects or bubbles have been removed, carefully place the casting on the die. There is serious potential for die damaging when a cast test is fitted, so therefore we have to be very careful. Do not push the die, force it on the coping on the die. If we see that the die doesn't fit easily on that the coping doesn't fit easily on the die, remove the coping from the die. Use the microscope to see if it's something inside a bubble or something that doesn't allow the coping to fit perfectly over the die. The casting should be seated completely without any pressure put on it. It should be stable so it doesn't rock on the die, and the margin should be perfectly in alignment with the margin of the coping should be perfectly matching the margin of the die. Okay. If the casting doesn't sit properly, try to determine the cause and check for bubbles, like we said before. If the casting gets warped or otherwise distorted, there is no other solution than to start all over again. So waxing, investing, casting, and all over again. Rough finishing of the casting surface. Finishing and polishing can be done rapidly and effectively only by well-organized use of progressively finer abrasive and polishing agents. In other words, when we're going to start finishing the surface of the coping, we start with the coarse type of burrs and stones going towards the finer um, burrs and stones, okay? Also, always use a caliper to measure. So make sure you have a caliper next to you. And when you do the uh, finishing of the coping, from time to time, stop and measure the thickness of the coping. We don't want the coping to be too thin. We have to maintain that thickness that we work so hard to do it during the wax up procedure. Um, Shape the spruce stump into a general contour of the casting with a heatless stone. Um, so here it says with the heatless stone, I will say, again, read the manufacturer instructions. Sometimes heatless stone doesn't work for all type of um, alloys. Sometimes a carbide burr is indicated. So make sure you understand from the manufacturer instructions how to finish the metal. But remove any gross scratches. Um, this is when it says that the dentist may have produced and give the casting a final finish. This is the case where we send the framework for trying in the patient's mouth. So sometimes if we have a long span bridge, before applying the porcelain, the doctor might say, just send me the framework. I want to try it in the patient's mouth to see how it fit. And that's done because sometimes the natural teeth, they have a little movement. And if the patient is wearing temporaries for a relatively longer period of time, the teeth might move. So the doctor wants to make sure that the fit of the framework is perfect before applying the porcelain. This is the time if the fit is not correct, then we can adjust and cut and resolder and solder the framework to fit perfectly. Okay, so that's what it means if the doctor sometimes modifies a little bit the framework and there are scratches on the framework. If the dentist did not finish the margin during the try-in, the technician also have to do it. Some technicians finish the margins with the casting seated on the die. Others prefer to finishing off the die. Neither method is completely wrong. It's just always have to make sure that the margin is not damaged. So slow when we concentrate on finishing the margin, slow speed, don't apply too much pressure, and always make sure you use the correct burr, not take too much off of the material. We don't want an abrasive burr that takes out too much material. When finishing and polishing margins area, all rotary instruments used must revolve parallel to the margin. So this is very important because otherwise can get caught into some of the um, little grooves and it can damage the margin. So this is how a surface of an alloy irregularities after finish with the burrs and then apply the sandblasting with aluminum oxide looks like. And this is what creates the mechanical retention for applying the porcelain. So we see in the picture here how under the microscope the surface of the metal is rough And that what creates a good bonding for the porcelain when we ready to apply the porcelain. So how we once we have everything done, we ready to kind of look inside and see if there are any, like I said, irregularities inside the copings. Also, the outside surface, we have to be careful if there are any irregularities. The margin, we have to be very careful. If there are any voids of bubble on the margin, these are very, very hard to adjust. Again, from time to time, we have to stop when we're doing the finishing of the metal and make sure we use a caliper to measure the thickness of the metal, okay? Make sure also to use the caliper that's used for dental alloys and not for waxing, okay? The ideal, this is crucial, ideal metal thickness for ceramic alloys depends on the alloy being used. For noble ceramic alloys, minimum it's 0.5 millimeter. For base ceramic alloys, minimum it's 0.2 millimeters. When we're feeding the metal coping on the die, we can use different um, marker materials like a quick spray, or we can paint on a different color of material that on the die, and then we can insert the coping over the die, and when we retrieve the coping, we're going to see inside where there is a little bit of marking from that dye color that we put. And that's where we're going to grind inside. We're not going to grind all over the coping if the coping doesn't fit properly. So we have to be very, very careful how we do the grinding inside the coping. So these are some of the stones and carbides we can use. So we can have assorted ceramic stones for metal finish, carbide burrs in variety of shape and geometries, and commonly used carbide burrs from number 0.5 to 2 to number 8. All mounted stones, wheels, and discs used to finish ceramic alloys should be composed of aluminum oxide to prevent contamination of the alloy. Heatless stones are not acceptable for shaping ceramic alloys or porcelain. In other words, when we start applying the porcelain, we should never use heatless stone. Okay. Another important aspect we have to be careful with is always have a set of burrs for and stones for different type of metals. So for instance, if I'm finishing a coping that it's made with noble um, alloy, right, that has gold, palladium, and so forth, I have a set of burrs and stone for that. If I have a coping that's made of base alloys, I have another set of stones and burrs to finish that coping. Never mix and match, because um, little particles of the alloys get embedded either in the carbide or in the stone. And when we start, uh, moving from one type of alloy to another type of alloy, a cross contamination takes place, and that changes the property of the metal. And then when we start to apply porcelain, the porcelain is not going to bond, so we're going to have more problems. So always make sure you have a kit of stones and burrs for different type of alloys when we finish those alloys, those copings. So direction of finishing metal substructures, start from left. Avoid finishing in different directions because this creates irregularities on the surface of the metal. In the middle, sometimes the irregularities might retain debris that can contaminate the porcelain. And we can also start from the right and finish the metal in one direction. That should leave the surface smooth and minimize the surface debris and irregularities. So always start from one side, moving to the other, okay? Always make sure you do it in one motion and you don't go from one side to another in a like a buzzing type of motion. So again, this is illustration how to finish the metal using different stones and carbides. And we can see that actually using the carbides and the stone, it leaves the surface of the casting a little bit rough. And this is what we're looking for because we want to have that rough surface for applying the porcelain, for the bonding with the porcelain. Okay, so like we said before, when we start finishing the copings, always begin with the coarse abrasive and going through the motion to end up with the fine burrs and stones. So the last step after we finish reshaping and contouring and fitting the coping will be to again sandblast, lightly sandblast the coping, and that does two things. First, it's removing any impurities that might be embedded in the surface of the alloy, but also condition the surface of the alloy to receive porcelain. The metal copings must be air abraded or sandblasted with 50 micron aluminum oxide at 80 psi. I will say in terms of the how many microns, the size of the aluminum oxide particles, and the pressure. Always consult with the manufacturing instruction. And after the sandblasting procedure is done, steam clean it or alcohol clean it before the application of the porcelain. And so this is how some of the manufacturer of alloys have, majority of them actually, they have this label where it says what type of alloy it is and also the composition of the alloy. So we can see here that this alloy it's made by, it's a noble alloy, it's made by the ivoclar vivident, and it tells us what type of metals are inside and the percentage for each metal. Okay, so not all manufacturers include sufficient product information on alloy packages to allow easy identification. Major manufacturers disclose most, if not all, elements in their casting alloy in product literature and on company website. So in other words, if you can find the information that you need, you can go either call them, you can call your manufacturer where you buy your alloy from, or go on their website and see if they have more information about the alloy. Dentists and dental technicians should be aware of the composition of the materials they use and include that information in the patient's dental records and on the laboratory work authorizations or prescriptions. So every time we return a porcelain fused to metal crown to the dentist, we have to return also the label that we see here, the blue label with the case, so the doctor can verify that we use that type of metal, right? So if we say we're using noble metal, then this is a verification that we use that, and also that stays in the patient's chart. So this is some of the regulations, okay, that are required by different states to um, kind of continue those um, continuing education courses. And why is that important? Because the materials and the procedures are changing very rapidly in our professions. There are new materials on the market almost every year. Something new is coming up, and we have to be careful and to stay, on top of it. And some states required that the dentist and the technicians, they need to take those continuing education courses. And also some states require that for a lab to be open, to have at least one certified dental technician hired in the lab. So that's something to keep in mind. All right, laboratory dust and precious metal reclamation. So lab dust. The risk of laboratory personnel of developing an occupational related respiratory disease has been associated with the inhalation of dental laboratory dust containing particles of silica from porcelain grinding, as well as aluminum, nickel, beryllium, and chromium particles from casting, metal finishing, and polishing. Also, so in this case, always when we grind, doesn't matter if we grind metal or we grind stone or acrylic, whatever the case might be, always wear a mask, goggles, put the suction on, so all the dust particles are contained in an area and you don't bleed those. For the precious metals, so when we start grinding and reshaping the framework, right, the copings, if we use a gold alloy-based metal, we don't want to throw out the little particles, the dust, the gold dust that we get from grinding the alloy. So always make sure that there is a way to recover that, and we can give that to a metal refinery company, and we can get paid for it. So a simple way to recover noble and precious metal is to vacuum each technician's lab coat and work area where the metal is cast, finished, and polished. Small vacuum cleaners can be utilized to collect the dust produced from metal finishing and polishing, and then use this in a collection bag and send over to a gold refinery for processing. And like I said, we get paid for the amount of gold we give. Biocompatibility. So in terms of patient adverse reactions, sometimes the patients have different reactions to different metal alloys that we use. So biocompatibility means the ability of material to perform its desired function with respect to a medical or dental therapy or treatment without starting a negative effect, local or to the whole system, and kind of try to not create any adverse reaction with the patient's body or other medical conditions that the patients may have. The biocompatibility of a material depends on several factors, such as, and we can see here, for Noble metals, gold, it's the best biocompatible element. There are very, very rare allergic reactions reported. Palladium, it's a very compatible material. Base metal, those are the most stable in oral environment because of passivation that produces oxide layer on the exterior surface as a barrier to corrosion and the leaching of the element. Exceptions are beryllium and nickel, which leach and are potential causative agents of adverse reactions in patients. Dental technicians potentially have direct physical contact with nickel-containing alloy and might develop contact dermatitis. Without proper protection, they also risk ingesting fine metal particles, inhaling metallic dust during the finishing procedures, and breathing vapors during casting that could lead to impaired health. Okay. The biocompatibility of a metal, like I said, depends on several factors: the chemical nature of its components, physical nature, type and locations of the patient tissue that comes in contact with the material. Okay, duration of the exposure, surface characteristics of the material, the amount of and nature of the substances eluded from the material. Okay, so we see kind of the different um, adverse reaction. It can be local adverse reaction, like for the skin, lips, or oral cavity in the lungs, or it can be a systematic effect that affects the whole system. So it could be neuro behavioral effects, you know, something that affects the respiratory system. Okay. Uh, we keep talking about when we select the type of coping that we use, the type of alloys that we use for the coping always have to be in relationship with the porcelain that we use. So they have to be compatible. And especially when we're talking about the shrinking and the expansion rate, because we use these material in the same oven, so their rate of expansion and contraction has to be compatible. Okay. Again, very important when we apply the porcelain, the junction between the porcelain and the metal is made of a molecular oxide layer. So the binding between the porcelain and the metal depends on how we finish and we treat the surface of the coping. Okay. The next step would be after we finish the coping, we sandblast it, we steam it, it's clean. The next step will be to degas or conditioning the alloy. So the the degassing process takes place in the porcelain oven. So we put those copings inside the oven, and again, each manufacturer of alloy, they give us the temperatures and how much we should raise the temperature per minute for the degassing. Usually the degassing procedure or the degassing bake takes a little bit, it's a higher temperature than the baking of the porcelain, because this is kind of like sanitizing the, uh, the copings. So let's take a look at the picture here. We have the oxidized noble alloy copings versus the oxidized base metal alloy coping, and we see the different colors. So the noble alloy are on the left, the base alloy on the right. So on the left, in the left picture, the first one, it's a medium gray color and moderate level of oxidation. In the center, high palladium copper alloy has a darker color, highest level of oxidation, and the right palladium silver alloy, light gray oxide layer. On the right picture, okay, for the base metal, starting from the left, that's beryllium, that's nickel chromium beryllium. So we see it's a light color. The center is nickel chromium, so it doesn't have beryllium. And then on the right, it's cobalt chromium. So this is how the oxide layer looks under the microscope. And again, this is how the porcelain creates that bonding uh, with the alloy. Okay. So what's going on sometimes? Why the porcelain breaks from the alloy? Well, sometimes the porcelain is not bonding well with the alloy because the oxide layer itself, it's either too thick or the procedure wasn't done correctly. Um, Note how the straw-like color on the oxide layer remains bonded to the porcelain and clearly separates from the metal surface. So the oxide layer now is transferred to the porcelain instead of being on the coping. So that's why the reason why the porcelain didn't bond with the metal. Porcelain metal incompatibility, and that's another issues that we have. So the cracking of the porcelain on the base metal alloys unit, it's an indication of a possible porcelain metal incompatibility that could lead to immediate or delayed bond failure. So if the metal and porcelain, they're not compatible with each other, there might be a problem on bonding. Okay, so always check with the manufacturer of alloys what type of porcelain we can use for that alloys. Improper design of the coping. So if we have a lot of porcelain that has no support from the coping, that also can do a damage on the bonding of the porcelain to metal. Okay. So bond failure, this type of bond failure, it's often time referred as loss of attachment or a delamination from the metal structure. So a complete detachment of porcelain from the metal may be caused by excessive oxide formation or poorly adherent of oxide layer. So you see how important that oxide layer is, and how important it is to do all the preparatory steps before applying the porcelain. Okay. Heavy greenish oxide are bonded to the porcelain and to the metal substructure, and this is mostly for base alloy called cobalt chromium casting. Okay. The bond failure may occur to the thick oxide layer, leaving oxides on both the porcelain and metal. So if the oxide layer is too thick, that may break, and also we're gonna end up when they separate each other, we're gonna see a layer of oxide on the porcelain and a layer of oxide on the coping. Gassing or bubbling. Surface contaminants, again, may be responsible for the bubble formation during the porcelain firing. So if, again, we didn't address and clean and, so to speak, disinfect the coping, before receiving the porcelain, we may have a cross-contamination or we have a surface contamination that also can interfere with the bonding between porcelain and alloy. Trapping gases, improper use of grinding burrs, stones, wheels, and or contaminants during the grinding procedures may also contribute to gassing in porcelains. Okay. Bubbling. High palladium copper alloy bubbling occurs when the manufacturer instructions were followed. Removal of the opaque bubbles reveal areas that the porcelain didn't bond or debonded during the opaque firing cycle. Refinishing the casting removed the surface and surface contamination and resulted in an appropriate porcelain metal bond. So the coping treatments, on the left we have the finished metal. In the middle it's the coping after the sandblasting procedure, and in the right is the coping after the degassing process, when the coping is ready to receive porcelain. So if there are any other questions regarding this topic, please address them during the lecture. Thank you.